All right, we're here for the third installation of this TMJ series. Today we're going to be looking at signs and symptoms, how to examine it, where does it go wrong, essentially. Let's get into it. So, I apologize for the slides quality. I'm just listing stuff at this point. What are some of the signs and symptoms of a TMJ problem? First, you want to think about the anatomy. So, we have that disc, we have this articulation, we have the muscles. So, things you might get are tightness in those muscles. You might hear some clicking or poppings from that disc. We spoke about that double mechanism of opening the jaw. You might get locking with that as well. Is that a spasm of the muscle? Sometimes it can be, or is that a true lock? In which case, you're looking more at like a dislocation. Um, Headaches, tender to touch, discomfort. I've underlined discomfort because I'm going to go on my own here, in my inexperienced opinion, and say that to me, hearing TMJ pain is already a bit of a red flag. Because most of the time, what you'll get is discomfort, disease, or maybe mild pain doing certain actions. Pain will usually mean something a bit further, a bit more advanced, something that's not just a dysfunction of the TMJ. Earache, tinnitus, I always say tinnitus apparently though, or fullness, a sense of being congested in that sort of area. Because of course we spoke about in that anatomy session about how the ears and the sinuses are all linked together. Tinnitus is an interesting one though. What might cause that? Just asking. What could cause tinnitus? Cranial nerves, damage, um, stress could be a thing coming straight from the brain. So that's just an interesting symptom that you want to ask more about. You can even get it. Some people have had it post tooth operations or reconstructions or whatever, and then it always comes back to the teeth. So interesting one. And then of course I mentioned this a lot: sense of malalignment, malocclusion, and that bruxism slash clenching that we were talking about. Where does it go wrong on examination? How on earth do you examine someone's jaw? It's quite hard. There's no right answer. But you want to start with seeing how things move. You want to reproduce the symptoms. When things get complicated, you don't know what to do, stick to the basics. How does it move? So you can get them to open their jaw. What are you looking for? You're looking for deviations or a Z shape on opening. This is quite a common thing. There's going to be other patterns, but from what I've read, the simplest ones to remember are open the jaw, you get that Z shape as it opens. I'm exaggerating it, but you'll see that. And that's as one side leads, which is another thing you're looking for, the leading. One side might open first and then the other one comes down, and that could be that Z shape, which you could also get on closing. If you put your fingers on the TMJ, I should have said this in the first video, how do you locate the TMJ? People say go to the ear. I don't like that. I say go from the zygomatic arch, because that's an easily palpable thing. Just follow that until you get to the end. Open and close. You'll feel something press against your finger on the opening. When you're feeling that in the leading, you'll feel one side pop out first and then the other. Sometimes you might just feel a pop out and then nothing at all from the other side. It just goes down. Clicks, clunks, palpable or audible, which could be that disc, it could be that articulation of the joint, it could be anything. Weaknesses on resisted movement. So we've now had a look at how the jaw moves. Let's examine the muscles. Active resisted muscle test. Opening, kind of a hard one to resist, but you can do the opening this way. Sorry, I meant closing is a hard one to resist. Opening like that. Resist the deviations. Protraction, retraction you can't really test. You might get the patient to do the closing, but again, it's not really an easy one to test. And the other ones will probably tell you enough, since closing is rarely going to be impaired. Those are the strongest muscles doing that. And the reflex or jaw jerk. So I'm going to go into this on the next video when we start talking about neurogenic lesions to the TMJ. But there's a reflex where you put your finger here and you hit the jaw, and what you're looking for is essentially no movement. And what you're not looking for, what you're hoping not to see, is a visible closure of the jaw, which would be hyperreflexia. This is really brief. I'm sorry, I'm rushing through this, not really explaining. Please leave comments if you have any questions. I will answer them. Differential diagnosis. This is what got me into the TMJ, because you have no idea what could go wrong, and you look into it and it just keeps going. I have a book here. Look how thick it is about all the multidisciplinary managements and diagnosis. This book has honestly almost cost me my life. Makes me want to quit everything, but there is a lot that can go wrong with the TMJ. Don't let anyone tell you otherwise. CVS. We've got that referral from the heart, the common, I've got jaw pain, you're having a heart attack. GCA, giant cell arteritis. We're going to go through these in the next video. Inflammatory components. You can get Sjogren's syndrome. Please tell me you know what Sjogren's syndrome is. If you don't, it's fine. It's essentially an autoimmune condition where you attack your exocrine glands, the glands that secrete things into a cavity, I think is the definition of an exocrine, whereas endocrine would be more into the blood or a vessel or closed system. Autoimmune is very associated with rheumatoid arthritis, with thyroid conditions, actually, even thyroiditis is autoimmune ones. And I like bringing this up because this is one of those cases where you have to think a bit with your common sense, which you're going to have to do quite a lot with the TMJ. And I'm proud of this one. This is a condition that affects exocrine glands. We have glands here. What's another condition that affects glands? Come a bit lower. Mumps. More common in children, can happen in adults. It's these sort of things. Neoplastic. Osteomas, for whatever reason, they love the face, unfortunately, and the jaw is in the face. Tumors, giant cell granulomas, bony metastasis, anything that will metastasize to the bone could go to the jaw, more likely to be from a cancer that's nearby, so it could be throat, could be something there, buccal, tongue, etc. Infections, this is the neurogenic stuff. You're thinking more cranial nerve 5, if you're familiar with your anatomy. Trigeminal nerve, that's what supplies the muscles of mastication. But you can also get it with pretty much any of those cranial nerves, such as number 9 here, the glossopharyngeal. Sorry, there was something on my screen. I'm not sure how. I just know that apparently that can refer to the jaw. Dislocation subluxations. I can't tell you how to put them back into place, but you might see them. More likely to be with traumatic incidences, or following traumatic incidences can become easier each time. Even things like shingles, you'd think it's more like those rib dermatomal things, but you can get it on the face, you can get it eyes, jaws. And what you can interestingly get is a post-herpetic neuralgia, where after you've recovered from the shingles, you can still have neuralgic pain in that area, which is why I've put that there. And then, of course, we have those glands, salivary stones and cysts as well, and cystic fibrosis. Again, that's one of those cases where cystic fibrosis is a genetic condition that affects salt production, which is why you get those lung symptoms principally, but it can also affect other exocrine glands. But that's what you got to screen for. You have to know that. You have to ask the questions about that. And we'll go into that in the next video once we deeply go through each of them. This is what you're going to be familiar with. This is what you're going to see. TMJ dysfunction. I hate dysfunction. Anytime someone says dysfunction, it doesn't tell me anything. Like, at least a syndrome is a collection of symptoms. Fine. What's a dysfunction? Pelvic girdle dysfunction? I can't believe I had to read that on a case note one time. What do I do with pelvic girdle dysfunction? What does that mean? Where? Which part? But TMJ dysfunction, I accept. Because it is very complex. And because it's very complex, and a lot of it influences each other, I believe you can get a TMJ dysfunction. That's fine. I accept this. I accept this. Disc dislocation. So we were talking about that disc. What muscle attaches to the disc? The lateral pterygoid. When that's tight, pulls on the disc. That can affect the way that you articulate. You can start, I'm going to use this word because I saw it once on paper, macerating it, or you're putting more pressures through it. You're breaking things up. It's not recovering as well because it's a disc. It doesn't have a great blood supply, and it can lead to disc dislocations. Trismus is the technical term for the spasm of these mastication muscles. People call it lockjaw. There's a quick test I'll show you now. You just do the 3 fingers in the mouth. If it fits, they don't have it. If it doesn't, they do. Not very proper, but that is the test. You might have seen it done. Muscle strains can happen, of course. I have a story about this. I'm sorry, I'm bringing lots of stories and random tangents. I yawned once, and then I don't know how, but I started getting pain under here. But it was definitely like a muscular pain. I think I just strained one of my suprahyoid muscles. Very weird experience. Positional stress we spoke about with the sort of anterior head positions is the classic. Sinus referral, anything in that region will refer to the jaw. And less commonly, we have things like eagle syndrome, which we'll go into. Cysts, again, on the gum teeth, mandible. It always comes back to the teeth. Ligament sprains are interesting. You can have a ligament sprain in your ankle, but what are they really doing in the jaw? So that's a nice thing to reflect on. And of course, we have OA and RA, which happens everywhere, of course, anyway. That's actually all I have for the examinations. So lots of tangents. I apologize. Again, always ask questions. And on the next video, we will properly dive into those conditions in a bit more depth. All right. Thank you.